This is the AV lecture for Lab 9, and this is the appendicular skeleton. The appendicular skeleton is highlighted in green on these two images to the right. This includes bones of the upper and lower extremity. In general, we have about 126 bones in the appendicular skeleton when we're adults, and we have about 80 in our axial skeleton when we're adults. And on average, adults have a total of 206 bones in both of these skeletal systems. We're going to be going over each of these bones today for the appendicular skeleton, and we're going to also highlight a lot of features. Now, a lot of these features are named with some kind of funny names, and I just taken this list from your book. So this table is actually in your book, but this is going to serve as a guide or a translation, you could say, for some of these words that might seem kind of jargony. So, for example, anytime you see the word process in anatomy, this is just a fancy word for a projection on a bone. The word tubercle means a smaller bump on a bone. Tuberosity is a large, rough area on bone. A spine is a short, sharp projection. A condyle is an irregular, smooth surface that articulates with another bone. And this is where you're going to have cartilage. And this is going to prevent bones from rubbing together. So I don't want to go over all these, but I just put this here so that you can use it as we're going through this AV lecture, again, as a way to translate some of these kind of weirder terms that we're going to go over. And again, this is also in your lab manual. I mentioned that the appendicular skeleton is made up of the upper and lower extremities. And specifically, these include bones of the pectoral girdle. So you can think of this as your shoulder. Upper limbs is going to be your arm, forearm, and hands. And then your pelvic girdle, think of those as your hips. And then your lower limb is going to be your thigh, leg, and feet. Okay, before we get into these bones, I just want to let you know what we expect of you on a practical quiz. On your next practical quiz, you should be able to identify all appendicular bones and provide right and left for all those bones. This is right or left is in the perspective of the patient, and it's always in standard anatomical position. You need to know three things to determine right or left for each bone. You need to know what is lateral and what is medial on the bone. You need to know what is proximal and what is distal. And you also need to know what is anterior and posterior. And we're going to go over all of this today. In addition, you need to be comfortable identifying other bone features on these bones. And these are going to be, some of these features are going to help you determine right or left, these three components. And other features that we'll go over are going to serve as muscle attachment points. And so the better you learn them now, when we get into muscles, the easier it will be to remember those features that muscles are attaching to. So we're going to go through each of these bones. Any feature that we highlight in red, this is a structure that is helpful in determining right or left. And so these are fair game for the practical. In addition, we're going to highlight other features in violet, and these are also going to be fair game for the practical. Okay, first bone we're going over is the clavicle. We're not calling it the collarbone anymore. We're calling it the clavicle now. We've got to know what's right or left for this bone, so we need to determine lateral and medial, proximal, distal, and anterior, posterior. So the sternal end, this is going to be our medial end. This is the part of the bone that attaches to the sternum. So that makes sense. This is our medial side. And then our lateral side is going to be the acromial end. So we know lateral versus medial. We still need to know what is superior, inferior, or proximal distal. And the conoid tubercle is going to help us determine that. The conoid tubercle is going to be inferior, and so it's always going to be on the underside of this collarbone, the clavicle, excuse me. And the final piece that we need to know is anterior and posterior, and we're going to use this conoid tubercle again, and that conoid tubercle is going to be on the posterior side of the clavicle. And so with that in mind, we have a right clavicle here. Here's an image of a left clavicle, and this is of a real clavicle in lab. You have our sternal end here. We've got our acromial end, our conoid tubercle. Let's put this medial, this lateral, and the conoid tubercle inferior and posterior, and so we have a left clavicle. Next bone we've got is the scapula. The scapula is also called your shoulder blade, and it's a posterior bone. There are a bunch of features here. Let's first go over these red features. This is the glenoid cavity here, and this is where your shoulder joint is going to be. This is where the humerus is going to fit in. So that means that this is going to be the lateral side. The spine of the scapula, if you reach back to your scapula and if you palpate your scapula, you will most likely feel the spine of your scapula. And this is going to be on the posterior side. And so we know what's posterior. The spine is going to be on the posterior side, and this image is the anterior scapula here. Now, last thing we need to know is the what's the proximal end or the superior end of this bone. And we're going to use this feature here, the coracoid process and the acromion process here. Now, both of those features are going to be superior. They're going to be on the superior part of the scapula. And we now have all of our information. We know what's lateral, we know what's medial, we know what's superior, inferior. And so this is going to be a right scapula. Now there are some other features here that we will not go over in this AV lecture, but again, they're boxed in violet. So these are fair game for your practical. Here is a image of a plastic scapula that you might find in lab. This is the anterior side because we do not have the spine of the scapula here. This is a posterior scapula, and here's our spine of the scapula. Our glenoid cavity is found here. This is where the humerus is going in. And we also have the coracoid process shown here and the acromion process shown here. And so let's put all this together. We've got superior, we've got lateral and posterior. So this is a left scapula. Now we're looking at the humerus, and the humerus is going to make up your arm. Okay, this is our arm, this is our forearm, but your humerus is in your arm. And let's first figure out the proximal end and the distal end here. The proximal end is going to be the head. This is the part that's going to articulate with the glenoid cavity at the scapula. And the distal end is going to be down here, and there's a feature here called the olecranon fossa. Remember from that translation sheet a couple slides back, a fossa is just a depression in a bone. All right. Now we're showing the anterior view here, and on the anterior view we've got a couple of important features. The first is this deltoid tuberosity. And as the name suggests, this is where the deltoid muscle is going to attach. We've also got down here a feature called the capitulum, and the trochlea. And this is where your radius and your ulna are going to articulate with the humerus and form your elbow joint. Okay, so we know anterior, we know posterior. The posterior side is going to have this olecranon fossa, this really obvious depression here. We know proximal distal. The head is proximal, the trochlea and the capitulum are distal. And then finally, we just need to know medial and lateral. And we have some pretty conveniently named features here. We have the medial epicondyle, that's going to be on the medial side of the bone. And the lateral epicondyle, that is of course going to be on the lateral side of the bone. Now the medial epicondyle is going to be an extremely important feature when it comes to muscles, particularly muscles in the forearm. So not only is it important in this lab because it's going to help you determine right or left for this humerus, but it's going to show up again in a couple of labs. So make sure that we remember that one in a couple of weeks. Okay, so we have all the components that we need, and we know now that this is a right humerus. Here is an image of a humerus taken from lab, and we have the anterior view here. Okay, so we've got our head up here, our deltoid tuberosity right there. Here's our capitulum and our trochlea. This is where, again, the radius and ulna are going to attach. And this is our medial epicondyle, lateral epicondyle here. On the posterior side, here is that olecranon fossa, that really obvious depression here. And our medial epicondyle, lateral epicondyle. And we put all this together and we've got a right humerus. Now we're moving into the radius and the ulna. These are the two muscles in your forearm, okay? And in standard anatomical position, all right, your radius is on the lateral side of your forearm, and your ulna is on the medial side of your forearm, okay? Here is our proximal end up here with the trochlear notch. And if we just go back here, remember this is called the trochlea. And so where do you think the trochlear notch is going to attach? Right on this trochlea of the humerus. This is going to be our distal end, and we've got two features here that are named the same and they're on different bones. This is a styloid process of the radius, and this is the styloid process of the ulna. And if we were just to feel on the medial and lateral side of your wrist, you can really feel that styloid process on both of those bones. All right, a couple of other things here. We have this radial tuberosity here. Okay, this is going to be on the anterior side of your radius. All right, so this tells us anterior for the radius. And this is going to be an important attachment point for your biceps brachii. Now we also have on the ulna a feature called the radial notch, which is going to be up here. And this is where the head of the radius, this feature here, attaches to the ulna. And it looks like this really smooth surface on the ulna. And because you've got two bones in your forearm, this feature on the ulna has to face laterally because that's where the radius is going to be. The radius is going to be attaching on the lateral side of the ulna. And so now we know that wherever that radial notch is, this is going to be the lateral side of the ulna. Okay? And so we're starting to put this together. Now on the posterior side of your ulna, you have a process called the olecranon process, and that's right here. And the olecranon process is your funny bone. It's your elbow. And you can feel that right now if you just bend your elbow and then palpate your elbow, you're touching your olecranon process on your ulna. Okay, so we know that this is going to be the posterior side. All right, so the key features that we want to jump out at us during a practical quiz is this olecranon process. That tells us the posterior side of the ulna. This trochlear notch, this tells us the anterior side of the ulna. This radial notch, this tells us the lateral side of the ulna. And then the radial tuberosity on the radius, and this tells us the anterior side of the radius. Now, if we put all of this together, remember that the ulna is going to be the medial bone in your forearm. The radius is going to be the lateral bone in your forearm. We know that this is a right radius and ulna. Now let's look at a real ulna. This is an image taken from lab. Okay, so we've got the anterior view because this is the trochlear notch. This is going to be our proximal end and the anterior side of the bone. This is going to be our distal end here. Now that radial notch that I was talking about, here it is. And I'm going to highlight that for you. Whoops. Here it is right here. I'll highlight that for you. This is that radial notch. This is where the head of the radius is going to fit in here. And so this is the lateral side, right? Can't really type. This is the lateral side of the bone. Now on the posterior portion, again, here's your funny bone. This is your olecranon process. And this is your styloid process of the ulna. So if we put all of this together, okay, this is our proximal end, distal, anterior, posterior. This is our lateral side. It has to be on the right side of the body. So this is a right ulna. Now let's look at our radius here. We've got our styloid process on the distal end. This is our head of the radius, and this is going to be the proximal end. Here is our radial tuberosity, so this is going to be our anterior portion, anterior side of the radius. And we know that the styloid process is going to face laterally. This is going to be anterior, and so we have a left radius. And again, this is going to be the lateral bone, the bone that's on the thumb side. Okay, now we're moving into the hands and the wrist bones. Okay, in our hands, we have bones called carpals. All right, and these are going to be our proper wrist bones. All right, and then we also have bones called the metacarpals, and these are actually what our hands are. Okay, and then our phalanges are going to be our fingers. All right, so we've got 5 metacarpals, and we number them 1 through 5. All right, so number 1 is going to be on the lateral side. That's going to be on our thumb side, and we just count to the pinky. So 1, 2, 3, 4, 5. All right, we do the same thing with our phalanges. We've got 1, 2, 3, 4, 5. All right, so it's pretty easy. Now, if you look at my hands, you can see that I've got these wrinkles here, right? I'm going to try to draw on here. I've got these wrinkles here that are pretty handy for anatomy because they're going to be the dividers of 3 different bones that we have in our phalanges. Okay, so we have, I'm going to write this out, proximal, middle, distal. We have proximal, middle, distal. All right, and that is the case for all of our phalanges 2 through 5. Now in our thumb, though, we only have 2, right? We've only got one wrinkle there, so we've only got 2 bones. So this is proximal, and this is distal. We don't have a middle on our thumb. All right. And another thing I should note is that in anatomy, we don't really call it our thumb. Our thumb is our pollex. All right. So let's move into these, and we've got some pretty helpful mnemonic devices for you. So we're first going to start out with our carpals. All right. And we have this nice mnemonic device. Some lovers try positions that they can't handle. And what we're going to do here is we're going to start on the proximal side. So we're going to start here, okay? And we're going to go lateral to medial. And then we're going to bump up a row, and we're going to go lateral to medial again. All right? And some lovers try positions that they can't handle corresponds with these bones: scaphoid, lunate, trichitrum, pisiform. And then on the distal row, trapezium, trapezoid, capitate, hamate. All right, so let's get into this. Here are the carpals. All right, these are carpals. You can think of this, you can remember this because you drive a car with your carpals. All right, you drive a car with your carpals. All right, and we're going to start on that proximal end. This is our scaphoid. And then we've got our lunate here, trichitrum, and then pisiform. All right, now we're going to bump back over to the lateral side. And we've got trapezium, trapezoid. This is called your capitate, this big one in the middle. And then you've got your hamate right here. All right, and the mnemonic device: some lovers try positions that they can't handle, is pretty handy. All right, so let's go over this again. Scaphoid, lunate, trichitrum, pisiform, trapezium, trapezoid, capitate, hamate. Now the best way to remember this stuff is to just print off a blank sheet. Just Google search a blank hand diagram and just fill it out 100 times, and you'll remember it like the back of your hand. All right, so now let's move into the metacarpals. All right, and again, we've got 1, 2, 3, 4, 5. We start with the thumb, all right, or our pollex, and we just number lateral to medial. 1, 2, 3, 4, 5. And again, this is our hand. All right, this is our hand. And then now we're moving into our phalanges, okay? And again, in phalanges 2 through 5, you have 3 different phalanges. You have proximal, middle, and distal, just like we drew on my finger here. But in your thumb, in your pollex, you only have 2. You have proximal and you have distal. All right, now we'll try to trip you up. On a practical quiz, we'll probably ask you what this bone is. And students love to say that it's the middle phalange 1, but that's not right, okay, because this is a metacarpal. So this is proximal phalange 1, distal phalange 1. Okay, so the other thing that we didn't discuss is how it's important to still give right or left for all of these bones, okay? Now, on a practical quiz, we won't ever just remove a bone completely and give you a loose trapezium and say, is this right or left, and what bone is this? We're not going to do that. We're going to give you an articulated hand and then highlight one of these bones. All right, but you always got to put right or left for any of these bones. So this is typically what you might see on a practical quiz. All right, we've got our left hand here. This is your first phalange and first metacarpal. Okay, 2, 3, 4, 5. Okay, this is going to be our lateral side, so this is where we would start some lovers try positions that they can't handle. All right, and we've got 4 carpal bones here, and then 4 carpal bones here. And this is the posterior side, same thing. Okay, now we're going into your pelvic girdle. So we're finished with the upper extremity. That's great, good job. Now we're moving into the lower extremity and your pelvic girdle. So your pelvic girdle, or your hips, is actually made up of 3 bones that are fused together. And those 3 bones are the ilium, which is here in this orange. This is in green, the ischium, and then this is the pubis in pink here. All right. Now, the ilium is going to be your most superior part of the pelvic girdle. Your ischium is going to be the posterior side, and the pubis is the anterior. So some features here that are going to help you out. The iliac crest. All right, when you feel your hips, all right, that ridge that you're feeling is your iliac crest. Okay, we have another feature here called the greater sciatic notch. This is going to help you with posterior. This will tell you that it's on the posterior side. This feature here is critical for our lab. This is called the acetabulum, and this is where your femur articulates with your pelvic girdle. And with that in mind, we know that this has to be a lateral feature, right? Because that's where your femur is going to be attaching. Okay, your ischial tuberosity. This is going to be a rough patch on the posterior side of your pelvic girdle. And when you sit down, this is what you're sitting on. All right. And there's some other features here that we're not going to spend too much time going over. But what you really need to know for right or left are these features in red: iliac crest, greater sciatic notch, and acetabulum. So with that in mind, what do you think about right or left for this pelvic girdle? This is in fact a right pelvic girdle. The male and female pelvic girdle differ in some key ways. First, the female pelvis is relatively larger and wider compared to a male's pelvic girdle. The ilium on a male's pelvis sits higher compared to a female's ilium. And if we look at where the 2 pubic bones meet, the female pelvis forms this U shape here, and the same spot on a male pelvis forms more of a V shape here. And the reasons for this difference is hypothesized to be because of childbearing. Now we're moving into bones of the lower limbs, and these include your femur, your tibia, your fibula, and then the bones of your ankle and your feet: tarsals, metatarsals, and phalanges. First bone in the leg or the lower limb is the femur. We have an image of an anterior femur here and a posterior femur. This end up here, where the head is indicated, this is going to be our proximal portion of the femur. This is where the femur will articulate with the acetabulum at the pelvic girdle. On the distal end, we have 2 condyles, the medial and the lateral condyle. And this is where we'll have articulation with the tibia, and this will form your femoral tibial joint, or your knee joint. So we know proximal, we know distal. We need to determine lateral versus medial. And we have 2 features here. We have the greater trochanter indicated on both of these views, and also the lesser trochanter. Now the greater trochanter is going to serve as an important attachment point for muscles. So not only is it going to help us determine right and left, but it's also going to help us when we get to muscles. So the greater trochanter is going to be on the lateral side of the bone, as we can see from this anterior view. So now we know proximal, distal, we know lateral versus medial. And lastly, we just need to know anterior, posterior. And if we look on this posterior view of the femur, we have a structure called the linea aspera. And this is going to be a feature that runs almost like a ridge on the bone all the way down the posterior side of the femur. And this feature, this obvious feature, is going to tell you that it's the posterior side of the bone. Now, the linea aspera is going to be really important not only for this lab, but also when we get into muscles. So it's important to learn this feature in this lab. So now we have all the components we need. We have proximal, distal, anterior, posterior. We have lateral and medial. And so this is a right femur. Now, some other features that we have not discussed yet. We have the lateral and medial epicondyles. This is similar to what we saw in the humerus. And again, similarly to the humerus, the medial epicondyle is relatively larger than the lateral epicondyle. And then finally, in between our two condyles where the tibia will articulate, there's a feature called the intercondylar fossa. And if we just break this down, inter means between. Between what? Our two condyles. And then fossa means it's a depression. So what this means is there's this little depression between our two condyles here. Next bone is our tibia. We're indicating both our tibia and our fibula here, but we'll just discuss the tibia for now. This is going to be our proximal portion, and that's because we have our lateral and medial condyles, and this is where the femur will articulate, and this is where our femoral tibial joint or our knee joint is formed. So we know proximal and we know distal down here. Let's determine anterior versus posterior. We're looking at an anterior view here, and we have a feature called the tibial tuberosity. And this is, remember, a tuberosity is just a bump on your bone. And if you can feel your tibial tuberosity if you just palpate just inferior to your knee, you will feel a small bump there. And this is your tibial tuberosity. This is going to be an attachment point for a muscle in your thigh. And so it'll be important when we get to muscles. But for this lab, it's going to tell us that this is the anterior side of the bone. So now we know proximal, we know distal, we know anterior versus posterior. So we need to determine medial versus lateral. Well, if we go down to the distal end, we have a structure here called the medial malleolus. And as the name suggests, this is going to be on the medial side. So this is, if you've ever felt your ankle bones, this is what you're really feeling, your medial malleolus. You're on your tibia. It has nothing to do with your ankle. And you can palpate this, if you just run your hand down the medial side of your tibia, you will feel that bump that typically we refer to as our ankle bone, and this is your medial malleolus. So why don't we put all of these features together? We have the tibial tuberosity, so this is anterior. We have our proximal portion because of our condyles, and then our medial malleolus, and this is a right tibia. Next, we have the fibula, which is on the lateral leg, and there are two features here. First is the head. This is going to be on the proximal side of the bone. And then on the distal end, we have the lateral malleolus. And this is what is going to form the other side of your ankle. You can, as we did with the medial malleolus, you can palpate down the lateral side of your leg, and you will feel that bump. And this is actually on your fibula, and this is the lateral malleolus. Now, the lateral malleolus is going to be somewhat pointy. And when you're looking at these bones in lab, look for that real obvious point on the lateral malleolus. And that'll tell you that that's the distal end of the bone. Also, you can see that on the lateral malleolus, there's somewhat of this flatter side to the bone that forms that point. And this is where you're going to have your first tarsal bone, which is part of your ankle. And so, again, this smooth feature on the lateral malleolus will tell you if this is, first of all, the distal end, but also if it's the lateral or the medial side of your fibula. And so if we put all those criteria together, we know that this is, again, a right fibula that corresponds with our right tibia. Now we have our tarsal bones, and our tarsal bones are going to be our ankle bones. You can think of them that way. Now recall that our wrist bones were called carpals, all right? But now we've got tarsals. So a nice way to remember the difference here is that you drive a car with your carpals, and then you walk on tar with your tarsals. So anytime you see carpals, think about driving a car, so your hands. Anytime you see tarsals, think about walking on tar. And we're talking about now your ankle and foot bones. We've got 7 of those bones. 3 of them are going to be proximal, and then 4 are going to be distal. And what we're going to do is we're going to start on the posterior side here, and we're going to kind of go from lateral to medial, and then we're going to go across laterally. And we've got a mnemonic device here: children that never march in line cry. And so let's go through these. First, we have our calcaneus. Okay, and your calcaneus is your heel bone. Then, so that's children, all right? That talus is right here, and this is where your tibia and your fibula are going to articulate with your foot. All right, so the talus is where that articulation is occurring. So we've got children that never is right here. This is our navicular. And it's called navicular because this bone kind of looks like a boat. It's U-shaped like a boat. And so think navy, navicular. Be a nice way to remember it. So children that never march. This is our medial cuneiform. Okay, medial cuneiform. Then we have another cuneiform, but this is our intermediate cuneiform here. And then we have our lateral cuneiform here. So this is children that never march in line, medial, intermediate, lateral cuneiform. And then our final bone, even though this is lateral, this is not the most lateral, we have one more here called the cuboid. It's somewhat cube-like. And this is going to be the last bone here. And so this is cry. To reiterate, children that never march in line cry. So calcaneus, talus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and then cuboid here. Again, the best way to remember these bones is to print off a blank diagram of your foot and just fill it out again and again and again. Now we're moving into our metatarsals, which are right here. Just like in the hands, we had our metacarpals. Now we have metatarsals, okay? And these are truly your foot now. And just like we did in the metacarpals, we're going to number them from medial to lateral, 1 through 5. So metatarsal 1, 2, 3, 4, 5. Pretty straightforward. And now we have our phalanges. And just like we did in our hands, we number them from medial to lateral. So this is 1, 2, 3, 4, 5. Now in our thumb, we call this the pollex. For our big toe, we call this the hallux. It has a different name here. Big toe is called your hallux. Now in your phalanges 2 through 5, recall that just like in the hands, there are 3 separate bones. We have proximal, middle, and distal. And that's for 2 through 5. In your hallux, or your phalanx 1, you only have 2 bones. You have proximal and you have distal. So let's go through these. This would be our proximal phalanx 1, distal phalanx 1, proximal middle distal phalanx 2, proximal middle distal phalanx 3, proximal middle distal phalanx 4, proximal middle distal phalanx 5. Now for the feet, just like we had in the hands, we'll never on a practical quiz just give you a loose bone from your hands or your feet. It will always be articulated, and we will ask you a bone from an articulated foot or hand. Now that means right or left is relatively easy to determine. This is clearly a right foot here, but you still need to tell us that as you do with the hand.